Now, Section 27 has slated the Gauteng Health Department for not allocating money to outsource urgent cancer treatment. The Public Interest Law Centre says the Provincial Treasury made over 700 million rand available to outsource radiation oncology services in order to address surgical backlogs. Now, it says the department is showing absolutely no signs of urgency and has missed its own deadlines. Let's discuss this now. I'm joined by Section 27 attorney Khanyisa Mapipa, of course, via Zoom. And thank you so much, Khanyisa. Good morning to you. This is quite worrying. I think also the lack of urgency equally concerning. But how did we even get here?
Good morning, Demelo. So this story starts back in 2020. Cancer Alliance, who is our partner and our client in this matter, had started reporting to the Department of Health around the rising number of radiation oncology patients who weren't being attended to in Gauteng. The department ignored these calls for help back in 2020, again in 2021, and then at the end of 2021, Section 27, Cancer Alliance and the Treatment Action Campaign actually held a protest in terms of which they delivered a memorandum to the Department of Health. This, following other letters as well to the department, prompted a response to form a task team, where the task team was formed by the Department of Health, and one of the objectives of the task team was to assist the department in ideas and suggestions and mechanisms in reducing the waiting list. So the Cancer Alliance then started off by, with the consent of the department and also obviously as a member of the task team, by collating a number of, or a waiting list or backlog list of patients who are awaiting radiation oncology treatment. Now I have to distinguish between the waiting list and the backlog list. The backlog list is the list of patients who've been waiting for cancer treatment for over a year, at that time for over a year, and for now for over 2 years. And as we know, cancer is a very time-sensitive disease, and so waiting for over 2 years is just it's a death sentence in many cases. And so, the waiting list then would be patients who are within the parameter or time for receiving the treatment. Yeah, and so following that, we offered to the department a number of solutions, and those solutions included perhaps the outsourcing of these services until the department was in such a state that they could meet the demand for such patients. And they agreed to this, but they said that they didn't have any funding for that. So Cancer Alliance and Section 27 then went on to negotiate with the Gauteng Treasury and as well as National Treasury for the allotment of a sum of money to deal with this crisis, which allotment was made on the 8th of March this year.
All right.
And honestly,
if I can just jump in there, and apologies, Khanyisa, because we really press for time, but if I may just come in there, it seems with that context, then we have the Gauteng Department of Health committing to a 3-step process that they would then embark on. Just take me through what the process is and if they have committed to it.
So following the formulation of the waiting list or the backlog list by Cancer Alliance, the first step in the process for the Gauteng Department of Health, which was agreed to, was that they would update the backlog list. So that means that patients who hadn't been seen over the past year would be added onto the list, and those who had been seen would be taken off. The second thing would be to clinically assess those patients, to see at what stages those patients are, whether they need other interventions, before they are then eligible again for radiation oncology. Then the third part of that process would be to appoint the service provider. Now, these three things could be done in parallel to allow for them to obviously do this at an expedited process. Since the last 3 months, all we know that the Gauteng Department of Health is that they are in the process of trying to update the waiting list. The second step, it's unclear whether or not they have clinically assessed the patients. And the third step, we definitely know that they have not appointed anyone to outsource these services to.
Yeah, I mean, we're having this conversation because of the slow snail pace of the department in this regard. You mentioned earlier on that, I mean, when it comes to cancer patients, we know that time is of essence in assisting these patients, and I can only imagine even personal cost that they also have to endure. When you engage with the Department of Health, what is their excuse, or at least their reasoning in terms of, number one, this pace, and also what they will do, what interventions they can at least commit to in terms of expediting this process?
Well, up to now, we haven't had any reasonable excuses that they've given us. We've had to essentially run after the department time and time again to get some sort of undertaking and update regarding where they are. At a recent meeting that we had on the 2nd of June, they had undertaken again to go through a process where, you know, they now initiate those 3 steps. And so the deadlines that they had undertaken was, the first deadline would be the 9th of June, which was this past Friday. The second deadline would be the 23rd of June. So what would happen on the 9th of June is that they would obtain a deviation from the normal procurement processes. And this is a legitimate and legal process, one that was used in the COVID-19 pandemic to expedite the procurement of services. The second deadline would be the 23rd of June, and they committed that by this date they would have briefed the private sector potential providers. The third date would be the 7th of July, and on that date would be the deadline for the private providers to come back with proposals on whether or not, you know, they can assist with this, what they're willing to, the outcome of the negotiations, essentially. And then the fourth deadline would be the appointment of these providers by the 21st of July. And so they had committed that by at least the beginning of August, they would have patients in machines getting radiation oncology treatment. Our concern now is that they've already missed the first deadline, which is the 9th of March. They haven't come back to Section 27 or the Cancer Alliance to say whether or not they've obtained the deviation. And that obviously is has a risk of pushing out the dates and making patients wait even further for critical services that they need to sustain their lives.
Yeah, and also equally concerning, I think, even for South Africans listening to this right now, Khanyisa, is that even with the resources provided, it seems the department again fails these patients, because by August 2023, I understand this is when the patients were supposed to begin their treatment through this outsourcing program. So now with the deadlines missed, it seems that August might see a pushback in terms of the starting date. Unfortunately, due to time, I have to leave it there. But thank you so much, Khanyisa, for bringing this to the fore. And hopefully we can get some response from the Gauteng Department of Health just to advise on terms of what exactly is being done to ensure that those needing these services, these critical health services, are assisted. All right, that's Khanyisa Mapipa from Section 27.